Loose implant crown. Bad day. Let's talk about what you do if you placed an implant, now you've screwed in an abutment and cemented a crown, and the patient comes into the office and they say, my crown is loose, and it's the crown on the implant. Well, if you don't know what to do, that's a bad day. Now, most of us screw the abutment into the implant and then we cement the crown. Especially in the anterior region, sometimes we will screw in the entire crown and abutment into the implant. There's no cement. That's an easy fix. You just remove the composite in the back or the top of the crown, unscrew the crown and the abutment, and screw it back in. But if you've cemented a crown and the crown is loose, the first thing you've got to decide is the implant loose, is the crown loose, or is the abutment loose? Most of the time, it's going to be a loose abutment. The composites are so strong that when I've cemented an abutment, a crown to an abutment, an implant abutment, I've never had the crown come loose. The other day, a patient presented in my office with a loose maxillary lateral incisor crown that was seated on an implant, and it was movable. He had a very deep vertical overjet, and he's a big gruxer, and the dentist had not given him a night guard. When I looked at a radiograph of the implant, there was a lot of darkness around the implant, which indicated it was moving. It's like a widened periodontal ligament around the tooth, indicating the patient's a clincher and they're moving the tooth. So in that patient's case, I felt like the implant itself was loose in the bone. It was de-osseointegrating. But most of the time, the screwing the abutment into the implant is the part that's loose. So first test it, take a PA, and be sure that the implant is osseointegrated. If the implant's not osseointegrated, you're going to see darkness around the implant. The second thing you want to determine is it the abutment that's loose or the crown that's loose? If it's the crown, put water around the implant, squeeze up with your fingers like this, and if the crown's moving off of the abutment, you're going to get some bubbles. If you don't create bubbles, then the screw that screws the abutment into the implant has come loose. That's going to be the situation 95% of the time. What makes it come loose? Probably it's a patient that's a clincher. And they just clench it, and if there are any eccentric contacts on that crown, they just work it, and somehow unscrew the screw in the abutment. Now remember, it's torqued to 35 Newton centimeters, so that's quite a task to unscrew that screw. But I've had it happen twice on patients of mine that I've placed the implant and I've screwed in the abutment. So it's not a big deal. You just need to know how to diagnose it, and now I'm going to show you how to treat it. So this is I first take my radiograph of the implant, and you can tell it's osseointegrated. There's no darkness around the implant. So after I take this radiograph, I know that there's a 99% chance either the abutment screw is loose or the crown has detached or debonded from the abutment. You can see it wiggling here. So I first tried to squeeze the crown up, and it's not moving. It's not moving at all. No air bubbles around it, so I know it's the screw that's loose. Take a coarse barrel diamond and just very gently, with light pressure, lots of water, cut a hole in the center of the crown. Take your time. If it's a porcelain to metal crown, cut through the porcelain with the barrel diamond, and then use a 330 carbide burr to cut through the metal. If it's a zirconium, an Emax, or a porcelain to zirconium crown, use the coarse barrel diamond burr to cut through the whole thing down to the screw. This way I've cut through. Now I'm just getting to the metal screw. I've put cotton balls in the orifice of the implant abutment, and then composite cement used to cement the crown in the very coronal part of that orifice on top of the cotton balls. Now the reason you do that, you never want to squirt composite directly into the orifice of the abutment all the way down to the head of the screw, or you're going to have problems if you ever have to tighten the screw, if the screw ever comes loose. Always put something in the orifice of the implant. You can use cotton balls, you can use plumber's tape, and then leave just a little, just on the very top of the orifice of the implant abutment, you'll squirt a little bit of the luting cement that you're cementing the crown with. So I'm removing these cotton balls. Don't pack the cotton balls in real tight either, as it makes it difficult to remove them. You're not planning on ever having to remove them, but if you did, this makes it a lot easier. So there you can see the orifice of the implant abutment and the screw. Now I'm going to place my finger wrench. It was originally tightened to 35 Newton centimeters, but now it's loose, so you're probably going to be able to unscrew it with your fingers. So remember, lefty loosey, righty tighty. So if you're unscrewing it, you're going to screw it counterclockwise to the left. So I'm able to unscrew that implant with my fingers. Then, once I've done that, unscrewed it a little bit, I'm going to go back and move that crown. Remember, the abutment is cemented to the crown, so I'm going to move it until it locks in to the hex of the implant. Then I'm going to hand tighten the screw and be sure the implant abutment is in the hex of the implant. And that's why I'm moving the crown, where I can't move the crown with my fingers while the screw is just a little bit loose. Then I'm going to use the finger wrench to tighten the screw as much as I can with my fingers. Then come back with the wrench, ratchet wrench, and tighten it to 35 Newton centimeters. See, here's 35 Newton centimeters. I'm going to take this periapical radiograph once I've tightened it with my fingers. I'm not going to tighten it with the wrench before taking the radiograph, so I'm going to tighten it with my fingers to be sure everything is seated, and then tighten it with the ratchet wrench to 35 Newton centimeters. I'm going to place these cotton balls in the orifice of the implant abutment. Then this is primer adhesive. Remember, since I've cut the occlusal part of the crown with my coarse diamond, there's tons of mechanical retention. So in this case, I'm not etching it. I'm not using silane. I'm just placing my primer adhesive and then blowing that off into a 2x2. See, I'm blowing it into a 2x2 and then curing it for about 5 seconds. Then placing a filled resin in that orifice, contouring it with an egg-shaped instrument, curing that for about as long as you want. I usually cure it for 60 seconds just to be sure it's completely cured. Then using a round fine diamond and a football-shaped fine diamond burr to contour. Very light touch, lots of water. Check the occlusion. This is just a Shofu rubber wheel for polishing. And that's the Dental Minute.